Hi, I'm Dr. Sabrina Discusses, an aesthetic oculoplastic surgeon based at 121 Hardy Street, and I want to talk to you about Malar bags or festoons. Malar bags or festoons are fluid-filled pouches that occur at the eyelid and cheek junction, and they're a very challenging condition to treat. And they're challenging because there's no one factor that's causative. You have multiple factors that can cause Malar bags. So let me talk to you about why they can occur. You may have hereditary Malar bags, which are not that common, or you may just have it as an aging change as you lose structural support in the lower cheek and the skin becomes loose. Lifestyle factors will predispose you to it. So particularly if you have very thin skin due to sun damage, smoking, rosacea, an overactive thyroid, underactive thyroid, kidney problems, all of these things can cause you to retain fluid here because they impact the eyelid lymphatics. And finally, the commonest causes that I see today is due to filler. So under eye filler and cheek filler, over the years, as it tries to dissolve itself or disintegrate, can impact the lymphatics and cause a swelling over here. And this can be very distressing for patients because it occurs years after they've had filler, and therefore they don't know why it's happened and they've forgotten that they've had the filler. But it can make people look old and it creates a deep shadow, which is very difficult to mask with makeup. So how do we treat Malar bags? Well, we really need to address the different causative factors. And for me, I offer surgery when a patient has moderate to severe Malar bags along with eye bags. Now, it involves a surgical procedure called an extended lower lid blepharoplasty. The cut is made below the eyelid, extends on the outside like this, and I lift up the lateral midface, or it's called a Sof lift. And there is a fair amount of downtime with this because the lymphatics have to recover and function again. And this is a big fudge factor for the patients because they have to appreciate that it's going to be a huge improvement in their under eye appearance, but it takes time for the improvement. And sometimes you can have recurrences because this is always an area of weakness. Now, when do I offer minimally invasive or non-surgical treatments? This is often for mild to moderate conditions, and the treatments I offer include either an Endolift, a tightening, radiofrequency microneedling tightening with Morpheus 8, or Ultraclear laser to improve the quality of the skin. If there's filler involved, I will use hyaluronidase, a dissolving enzyme, to dissolve the filler and then tighten these tissues. And all of these patients require some form of lymphatic drainage. In the clinic, we offer the LPG Endermologie, which is negative pressure lymphatic drainage, and we get great success with a minimum course of 12. You have one every week, or you can have manual lymphatic drainage at home. So, no one size fits all for the festoons or Malar bags. And if you would like more information, please feel free to visit the website, which has got so much information on it. My team is always on hand to actually give you information, so feel free to give us a call.